listening to Planet Vero Radio. This is Patient Partners. We're broadcast on 101.7 FM Real Radio WCZR, and I'm also podcast on Spreaker as well. I'm going to talk today a little bit. Jeannie Rollo's got the day off. I'm going to talk a little bit today about some things that I looked up as far as licensing and education in Florida. That's where I'm located in Florida, and I talk a lot about the things that happened in my health care in the state of Florida, going to different hospitals, different doctors. Jeannie Rollo talks about things in other states, and we've got other people on that talk about different states because we're trying to bring the attention to that it's not just one state where these things happen. It's basically nationwide. Actually, it's worldwide. If you listen to some of the Twitter feeds and all of that, it's just really sad that people have to put up with this, certainly when you are that ill. And when you're facing serious and oftentimes dire circumstances and you really just don't know what to do, and you're going to try to trust the people that you should be able to trust. And then we find later on that really that wasn't so much the case. You should have asked these questions. You should have done this, should have done that, should have zigged, should have zagged. Everybody's a Monday morning quarterback, as they label it sometimes, and they're like, I certainly was like, why didn't I do this? Why didn't I ask that? And I beat myself up over it. But you can't do that because it is what it is, and you have to move forward from it. So I want to bring this up. It's kind of a yin and a yang kind of a thing, and I'm just throwing it out there. It's really no opinion. It's just kind of stating the facts. And I looked up on the floridanursing.gov website about licensing for nurses. And I was looking specifically for surgery techs on that website, and I kind of knew that the surgery techs weren't going to be on there, so I'm going to try to compare these two. One of it is CNA licensing, so Certified Nursing Assistant licensing, as opposed to surgery tech licensing. And the reason that I picked those two is, to me, they're kind of similar things, but in different applications. So in other words, those are the people that you meet. I don't want to say doing the grunt work, but a lot of that it's the grunt work. I personally took a CNA course years ago in the state of North Carolina, and it was a 9-month course, and it was geared toward geriatric patients because at the time, the statistics said that there would be umpteen number of geriatric patients going into nursing homes and assisted living care, and they didn't really have the terminology per se back then, but they knew baby boomer people were going to be of a certain age at that time and would definitely need care, and certainly skilled care. So I know a little bit about what a CNA course is, and I knew how stringent the one that I personally took was because it was for 9 months, and they ran us through the ringer. They really did. I mean, we did all kinds of things. There could be no bed sores. I don't care if the people were soiled 5 times a day. That's when you cleaned them. And I went on, and I'm just making a little bit light of it. We certainly did not do IVs. We didn't do anything with the veins. We didn't do blood, anything like that. But as far as the actual care of the patients, it was pretty intense. It was the training. And so I was totally impressed with how they did that. Nowadays, what I'm reading, and I'm going to take this right off of that website, and it says for CNA licensing, and this is for Florida, a state-approved training program is not required prior to your examination for the licensing for the CNA in Florida. A high school diploma or its equivalent, or to be 18 years of age, is required if the applicant is challenging the exam without completion of an approved training program. And I've personally talked with CNAs recently, probably in the last 2 or 3 months, that said they did sit for the licensing and did not have any specific training course whatsoever. They kind of learned it on the job and going to different jobs, different facilities. You also can be an applicant to become a certified nursing assistant by endorsement. And those people must successfully pass the required background screening, and also are as follows, and can be found in section 464.203, is currently certified in another state or territory of the United States or in the District of Columbia, is listed on that jurisdiction's certified nursing assistant registry, and has not been found to have committed abuse, neglect, or exploitation in that jurisdiction. Excuse me. So you can become licensed by endorsement without taking any testing in Florida. As far as a surgical technologist in Florida, and I got this off of surgicaltechedu.org/Florida, surgical technologists are healthcare professionals who assist patients and surgical teams before, during, and after surgical procedures. Surgical technologists are also called surgical techs, scrub techs, or operating room techs. They are responsible for preparing patients, the operating room, and surgical equipment for surgery. They also help the surgical team scrub for surgery by dressing them in sterile gowns and gloves. Another task they are responsible is monitoring the patient's vitals and surgical instruments and equipment during surgery. Finally, they transport patients from the OR to recovery. These people are also the ones that are in the room that are privy to the naked patients, the intimate exams, and what have you. And surgery techs, the educational requirements in the state include being a high school graduate or having a GED. Completing an accredited surgical technology post-secondary program is not required statewide. So there is no training that is required by the state of Florida. There is certainly no licensing, and there is no certification for a surgery tech. However, many employers throughout the state do require training. So basically, it is on-the-job training in a lot of instances. And from what I've read, look this up, every state is different. You need your name, an address, and a phone number to become a surgery tech in Florida. A CNA, you don't need any licensing course, any formal education. You can do it by endorsement. On the other side of this story, and I commend him for doing this, Florida Governor Ron DeSantis, and this is a news release from January 5th of 2023, so just a couple of days ago, has awarded $79 million for high-performing nursing education programs in Florida. The funding rewards public post-secondary nursing programs that have gone above and beyond to train Floridians and provides matching funds for scholarship awards. And I'm reading this right off of the website. Faculty recruitment, equipment, and additional educational supports. Quoting Governor DeSantis from this, it says, "These awards will meet a critical need of our state by ensuring we continue to have high-quality nursing graduates and by creating new opportunities for Floridians interested in healthcare," said Governor DeSantis. "I am grateful to the colleges and universities who have gone above and beyond to train the next generation of nurses in our state." And that is talking about nurses. So I'm trying to get to the bridge of where the training is specifically for nurses, but not specifically for the people, the CNAs and the surgery techs. They're in the room with you when we as patients assume that these are, most often assume, I certainly did, that these are educated, licensed, certified people that are working with you, have access to your intimate parts, have access to, your charts and all this and all of this, and they're not licensed and they're not certified and they're not registered. I personally have a problem with that because I'm afraid now, after I saw it through my own situation, which is what prompted me to start this podcast. Jeannie Roller, the same thing. Other people that we have on the show, the same thing. It was personal experience and personal trust that was just obliterated when we found out that these people really shouldn't be, in my opinion, the ones that I had working on me, should not have been in that situation, in that OR with me, in that serious of a surgery. And I was in there literally fighting for my life, and they couldn't have cared less to help me, to explain anything. I didn't even know who they were, even though I asked. And so I've been trying to do more in-depth information on that for my own peace of mind, but also to know, who these people actually are. So look it up in your state. If you have any questions, do some research and look at some of these state websites. But until next time, you've been listening to Planet Vero Radio. Please stay tuned.